Hey guys, this is FixerMed. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 34 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Today, I'd like to open up the presentation by covering the head and uncinate processes of the pancreas. The head of the pancreas is situated within the curved region outlined by the duodenum and is intersected by the common bile duct. This area encompasses the uncinate process, which is traversed by the superior mesenteric vessels. All right, moving on. All right, next topic, cancer of the head of the pancreas. Tumors affecting the head of the pancreas exert pressure on the bile duct, leading to obstructive jaundice. This form of jaundice typically manifests without accompanying pain or fever. In contrast, hepatitis-induced jaundice is often accompanied by fever. All right, moving on. All right, next topic, neck of the pancreas. Behind the neck of the pancreas is where the portal vein forms. This process involves the fusion of the splenic vein with the superior mesenteric vein to create the portal vein. All right, now that we have covered all of the content for today, let's look at some NBME-style multiple-choice questions to test your knowledge. Which of the following structures is most likely to be affected in a patient presenting with abdominal pain and jaundice? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The description provided indicates the involvement of the head of the pancreas, which is situated within the curved region outlined by the duodenum and intersected by the common bile duct. Furthermore, the presence of the uncinate process, traversed by the superior mesenteric vessels, suggests the involvement of the pancreatic head. Tumors or inflammation in this area can lead to compression of the bile duct, resulting in obstructive jaundice and abdominal pain, which are consistent with the patient's presentation. Therefore, the correct answer is E, pancreas. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, gallbladder. While gallbladder pathology can also present with abdominal pain and jaundice, the description provided specifically points towards the involvement of the pancreas, not the gallbladder. The presence of the common bile duct intersecting the region of interest, along with the reference to the uncinate process and superior mesenteric vessels, indicates pancreatic involvement rather than gallbladder pathology. B, spleen. The spleen is not directly related to the described anatomy of the pancreatic head, the duodenum, and the common bile duct. While splenic pathology may cause abdominal pain in some cases, it typically does not result in jaundice. Additionally, the spleen's location is distinct from the area described in the question, making it an unlikely source of the patient's symptoms. C. Kidney. The kidneys are situated in the retroperitoneal space, distinct from the anatomical region described in the question. Abdominal pain and jaundice are not typically associated with kidney pathology. Therefore, kidney-related issues are unlikely to be the cause of the patient's presentation. D. Liver. Although liver pathology can result in jaundice, the description provided specifically focuses on the pancreatic head, the duodenum, and the common bile duct. While the liver is anatomically related to the bile duct system, the description does not suggest primary liver involvement. Furthermore, the involvement of the uncinate process and superior mesenteric vessels points more towards pancreatic pathology than liver pathology. All right, now that we have covered this question, let's move on to look at the next question. A 65-year-old male presents to the clinic with complaints of jaundice and abdominal discomfort. Further investigation reveals obstructive jaundice with elevated levels of direct bilirubin. Imaging studies reveal a mass in the head of the pancreas. Which of the following mechanisms best explains the pathophysiology leading to obstructive jaundice in this patient? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The description indicates a mass in the head of the pancreas, which can exert pressure on the bile duct, leading to obstructive jaundice. This mechanism is a common cause of obstructive jaundice in patients with pancreatic tumors. Therefore, the correct answer is D, pressure on the bile duct by the tumor mass in the pancreatic head. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, direct invasion of the liver by pancreatic tumor cells. While pancreatic tumors can metastasize to the liver, direct invasion of the liver by pancreatic tumor cells is less common and not typically associated with obstructive jaundice. B, compression of the common bile duct by the enlarged gallbladder. Enlargement of the gallbladder does not typically result in compression of the common bile duct, leading to obstructive jaundice. C, impaired bilirubin metabolism due to liver cirrhosis. Liver cirrhosis can lead to jaundice, but it typically results from impaired bilirubin metabolism rather than obstruction of the bile duct. E, obstruction of the cystic duct by a gallstone. While gallstones can cause obstructive jaundice by obstructing the common bile duct, the description specifies a tumor mass in the pancreatic head as the cause of the patient's symptoms. All right, now that we have covered this question, let's move on to look at the next question. A 50-year-old male presents to the emergency department with severe abdominal pain and signs of gastrointestinal bleeding. Imaging studies reveal a mass behind the neck of the pancreas with compression of nearby vessels. Further investigation demonstrates an enlarged spleen. Laboratory tests show elevated levels of serum bilirubin. Which of the following mechanisms best explains the pathophysiology leading to the patient's symptoms? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The description indicates a mass behind the neck of the pancreas, which can compress the nearby splenic vein. Compression of the splenic vein can lead to thrombosis, causing splenomegaly and gastrointestinal bleeding due to portal hypertension. Therefore, the correct answer is E, thrombosis of the splenic vein due to compression by the pancreatic mass. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, rupture of an aortic aneurysm causing compression of the splenic vein. While aortic aneurysms can lead to compression of nearby structures, the presence of a pancreatic mass and signs of gastrointestinal bleeding suggest a different etiology. B, compression of the superior mesenteric vein by the pancreatic mass, leading to portal hypertension. While compression of the superior mesenteric vein can lead to portal hypertension, the description specifically mentions the fusion of the splenic vein with the superior mesenteric vein to form the portal vein behind the neck of the pancreas. C, obstruction of the common bile duct by the pancreatic mass causing obstructive jaundice. While pancreatic masses can cause obstructive jaundice by compressing the common bile duct, this mechanism does not explain the patient's signs of gastrointestinal bleeding and splenomegaly. D, direct invasion of the liver by the pancreatic tumor leading to hepatomegaly. While pancreatic tumors can metastasize to the liver, direct invasion of the liver by the pancreatic tumor is less common and typically does not cause signs of gastrointestinal bleeding and splenomegaly. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.